Hi, my name is Shirley Gutkowski. I'm a dental hygienist and I'm speaking to you today from my home office. I'd like to talk to you today about periodontal probing. That is something that seems to be, I don't even know what to call it, but most patients don't realize that they're having a periodontal examination, and they are. And some people are very aware that they're having their probings done and they are not happy about it. So I wanted to talk to you about that a little bit. So if you're on YouTube right now, otherwise you wouldn't be listening to me. If you go to YouTube and you search periodontal probing, I'm sure you've come up with little animations that show how periodontal probing is done. And in dental hygiene and in dentistry, we seem to put a lot of emphasis on periodontal probing and the outcomes of the periodontal probing. What I would like to have you do is when you go back to your clinician, when you go back to the periodontist, or when you go back to the dental hygienist or the dentist, ask for a saliva test to make sure that you have periodontal disease. The periodontal probing has some really severe limitations. And when you get right down to it, really it's a bent wire with some markings on it. There's subjectivity that's involved there, and the dental hygienist or the dentist who's doing the probing is not usually calibrated with the rest of the clinicians in the office. They rely mainly on the amount of bleeding that occurs during the probing. Now, for the most part, tissue that's healthy won't bleed. But the bleeding doesn't really tell us that there's an infection there. It could be that your clinician is heavy-handed. They hate hearing that, but it is true. We do have at least one study that, of course, I can't find again, so I can't cite it exactly for you, that shows that probing happens with more pressure at the end of the day than it does at the beginning of the day. If your clinician has any kind of hand issues, if the gloves are too small, if they're having some carpal tunnel issues, they're going to use more force. If they just got off the phone with bad news, or they were just called on the carpet, or someone just put an extra patient into their schedule or took one out, or a number of different reasons why a clinician would be distracted from probing purposefully and with accuracy. I would also like you to ask your clinician how much pressure they're supposed to be applying to their probe, and you will find that no one knows. The answer to that is 15 grams. Please don't ask me how many newtons that translates into, because nobody knows what that is. And it's really uncomfortable to have these conversations with your clinician. So the best thing from my perspective, if I was doing your probing and you were coming to me with a question, is to say, could you please do another test to make sure that I have periodontal disease, and not get into all of this other thing. If you're having trouble, send them to me. My name is Shirley Gutkowski, Gutkowski. I will set them straight. You can find me anywhere on the internet, provided you spell my name right. Gutkowski. I am also happy to be your patient advocate. I'll talk to you soon.